What does continuity of care mean in physiotherapy practice? This is a question I've been thinking about this week following an inquiry we had on the telephone. And the lady asked, would she be seeing the same therapist for each treatment? And that struck a chord with me because it's frequently a conversation we have with patients, and it's something they express an opinion about, that they, if they were in practices where they were seeing a different therapist for each treatment session, they found that there was a lack of continuity. So continuity of care really means that it's the same therapist managing you throughout your episode of care for a particular condition. And the reason that's important, one, obviously, is that on your initial presentation, the therapist who examines you is the one who gathers all of the facts relative to your condition at the time that you present, and from that situation then plans a treatment regime based around their findings. Then obviously, if they're the ones who are delivering the care, then they can monitor closely with each treatment session whether your condition is responding appropriately, or whether there are some surprises or some unexpected things. And obviously, if you have unique characteristics in terms of how you respond to injuries. Some people have more extreme inflammatory reactions. Some people, their muscle control switches off. Some people just have a greater level of tissue sensitivity than others. So these are all unique characteristics to you, and the therapist who knows your history or has been involved with managing your care for other conditions will be able to factor that in. And although that information can be categorized and listed in the clinical notes, it's not the same as actually experiencing it with a patient. I'm sure some of you have had the experience of changing GPs, and if you have a lengthy medical history, trying to relay that history in a chronological fashion it can be challenging, and trying to be confident that the new clinician has processed all of that information and has quantified it in a way that reflects your concerns about particular issues, and also has processed it in a way to come up with an effective management plan, and has been able to relay that to you. These are all critical parts of the patient-therapist relationship, whereby you need to have confidence that the information that you've handed over, or really the information that's been extracted from you from systematic questioning and systematic examination, is actually being used to try to speed up the recovery process and try to put in place the most effective treatment regimes. So it's a question that often comes up. I've never been a fan of switching therapists between episodes of care, unless, of course, if there's emergencies where a therapist is off sick or something along those lines. But it is much better from a patient's point of view and from a delivery of care if one therapist follows the condition from start to finish in a concise manner. Now, there will, of course, be situations where a patient may have an aggravation of an acute problem, let's say an ankle sprain, and they may have a long history of back issues. And in that situation, it's quite common for another therapist within the practice, who may be able to see them in a more timely fashion, to commence an episode of care. But then they're in the position of doing a full, thorough, systematic examination on the time of initial presentation and structuring their care from that point on. So that still is would fit into the category of continuity of care for a specific condition, which may or may not be relevant to a previous long history. So I'm not a fan of swapping therapists for each treatment session. It can be effective from a clinical management point of view in terms of its keeping therapists busy and making sure people don't have downtime. But in terms of benefits for the patient, I think it's much better that one therapist sees them from start to finish. Now, to some extent too, it also depends on the kind of treatments that are being conducted. If it's simply using hot packs or using machines of one form or another, interferential, ultrasound, laser, all of these kind of devices where it's just simply plugging in a machine, then really there's not a lot of analysis involved in that. So that kind of service does lend itself to swapping therapists. But if one's trying to do systematic examination where you're evaluating range of movement, muscle function, joint mechanics, general functional capacity. All of those things require a trained clinical eye to observe these test responses and be able to devise specific treatment programs based on what the findings are. So that does require individual one-to-one continuity. So I hope I've made the case for continuity of care under one therapist. It is an important issue. And I think we see people in both camps. Some people who maybe are just used to therapy shopping, just rocking up for treatment and not necessarily embracing the idea that if it's a complex problem, somebody needs to sit down and systematically work their way through a whole number of layers of complexity to try to get to the root of the problem. And then that will depend on the kind of condition. If it's something more simple, like an acute ankle sprain, and it's a fresh injury, then there may not be much relevance to the medical history. So a lot of how the care is delivered is dependent on the kind of caseload that you see. In our practice, we tend to see a lot of long-standing chronic problems where one's trying to optimize people's function to the best of their ability. They may not be able to function at 100%, but one's trying to maximize their capacity. And in that situation, it's very important that we factor in all the different variables that are involved with care. So that was just a clinical thought that was prompted by a telephone call. I thought I'd like to share that with you today, and we'll see you again on another video. Bye for now.